Have you ever caught yourself doing that thing in a photo where you intentionally hide your smile?
Oh, yeah. Like the closed lip smirk.
Exactly. Or maybe you're out at a restaurant, right? And you find yourself actively chewing on only one side of your mouth
Right, totally avoiding your absolute favorite crunchy foods.
because you have this sensitive tooth, or worse, a missing one. Well, if you are nodding along right now, you are definitely not alone.
Definitely not alone.
Welcome to today's deep dive. We are looking directly at something most of us would really just rather ignore until it absolutely hurts, which is the physical mechanics of our teeth.
Yeah, it's a topic people actively avoid.
But we are doing it today by looking at a massive collision between two very different worlds.
Two very distinct sources we have today.
Right. So on one hand, we have the stark, highly mechanical, government-backed clinical guidelines from Health Direct Australia.
Which are very straightforward.
Very. Detailing the harsh realities of what happens when a tooth fails. And then, colliding right into that, we have the modern marketing of dentistry. Specifically, we're looking at a promotional script from a clinic called My Gentle Dentist at Arana Hills.
Which is fascinating because they treat dental work almost like, well, a relaxing spa day.
It is a totally different vibe. Our mission here is to separate the facts from the fear and really understand exactly how modern dentistry restores both structural integrity and, honestly, personal confidence.
It really is a fascinating friction point between these two sources. On one side, you have this cold, hard biological reality.
The clinical side.
Right. The reality that the human mouth is just an incredibly hostile environment, and repairing it requires invasive structural engineering.
Wow. Yeah. Invasive structural engineering.
Exactly. But then on the other side, you have an industry desperately trying to rewire our psychological response to that engineering. They're wrapping advanced medical procedures in the language of wellness and comfort.
Okay, let's unpack this, because before we can talk about how a modern clinic uses high-tech materials to rebuild a smile, we really have to confront the physical toll our mouths take every single day.
It's a lot of wear and tear.
It is. The Health Direct clinical data points out that teeth become weakened for a massive variety of reasons, and it goes way, way beyond just, eating too much sugar.
Oh, absolutely. The structural integrity of a tooth can be compromised by something as delayed as an old sports injury.
Wait, really? Like from years ago?
Yeah, you might have taken a hit to the jaw, say, a decade ago, and only now is that microfracture causing the tooth structure to finally give out.
That is wild.
And then there is the biological aftermath of a root canal, which is a very common procedure.
Right, people get those all the time.
But once a tooth has had a root canal, its internal blood supply and nerve are just gone.
So it's essentially dead.
Yes, it becomes incredibly brittle, much like a dead branch on a tree.
Oh, that's a really good visual.
Add in severe decay, or simply the mechanical wear and tear of chewing thousands of meals over a lifetime, and the enamel just eventually surrenders.
And it isn't strictly structural failure either, right? Like cosmetic issues drive a massive amount of dental intervention.
Oh, for sure. Aesthetics are a huge factor.
People are looking to fix severe stains or chips or teeth that simply grew into unusual shapes. But the real mechanical crisis, the scenario where doing nothing becomes the absolute worst option, is when a tooth fails completely and you are left with a gap.
And this is where we really have to look at the biomechanics of the human bite.
Okay, biomechanics. Walk me through that.
Well, a missing tooth doesn't just create an isolated empty space. Your teeth actually rely on each other for structural stability.
Like they hold each other up.
Precisely. They provide lateral support to their neighbors. So the moment you introduce a permanent gap, you trigger this domino effect.
Because the support is gone.
Right. Without that lateral pressure, the surrounding teeth will slowly, inevitably start to drift and tilt into the newly available space.
It makes me think of like a tightly packed bookshelf.
Yes, great analogy.
If you pull a really thick book out of the middle of the row, the remaining books don't just defy gravity and stand perfectly straight forever.
No, they don't.
Eventually, they start leaning and collapsing into that empty gap. And in the mouth, I imagine that collapse messes up the entire chewing mechanism.
That structural collapse alters your entire bite alignment. When those neighboring teeth lean, your upper and lower arches no longer interlock correctly when you close your mouth.
And that causes problems.
Major problems. That misalignment acts as a wedge. It transfers unnatural stress directly up into your jaw joint, the temporomandibular joint.
Oh, wow. So a problem in your teeth becomes a problem in your jaw.
Exactly.
Hmm.
This is how ignoring a single missing back tooth eventually translates into chronic radiating jaw pain and tension headaches.
Yikes.
And the Health Direct clinical guidelines highly emphasize that delaying a final restoration, like, say, putting off getting a crown after a root canal, significantly increases the chance that the remaining brittle tooth will shatter completely.
Under that uneven pressure.
Yes, requiring a full extraction.
Okay, so we have this incredibly high-stakes biological reality. If you delay, the structural collapse spreads. But people still put it off? If delaying a final crown after a root canal is so risky, why do people put it off? Is it purely the fear factor?
What's fascinating here is how clinics are actively trying to combat this exact hesitation through branding.
Right, like the My Gentle Dentist script we reviewed.
Yes, they know people are terrified of the chair, so their marketing completely shifts the narrative away from the clinical mechanics we just talked about and focuses on a calming, patient-focused, judgment-free environment.
They're trying to psychologically disarm you before you even cross the threshold.
And the spa-like marketing isn't just about getting patients through the door for financial gain, you know. It actually serves a crucial clinical function.
Wait, a clinical function? How does a nice waiting room help the clinical side?
Well, the materials used in modern dental restorations are incredibly strong, but they are vulnerable to the extreme forces of bruxism, which is teeth grinding and clenching.
Ah, okay.
If a patient is terrified, carrying immense anxiety into the chair and anticipating pain, they're going to carry that tension in their jaw.
Right, they're going to be locking up.
Exactly. A relaxed patient who feels safe and free from judgment is fundamentally easier to treat. And the long-term success of the dental work actually improves when chronic jaw tension is reduced.
That makes perfect sense. The gentle environment is basically a clinical requirement to protect the investment.
It really is.
So let's talk about that investment. When the bookshelf is starting to collapse, the structural solutions are designed to halt that process. We're talking about the armor for your smile. Crowns and bridges.
Let's break down the dental crown first.
Sure.
Clinically speaking, a crown procedure involves covering an existing damaged tooth with a custom-made cap.
So it's not a whole new tooth, it just goes over the old one.
Right. It is engineered armor that slides perfectly over the biological remnant of your tooth. The objective is to restore the tooth's original shape, drastically increase its structural strength, and return its full chewing function so your bite aligns perfectly again.
And the materials have evolved light years beyond what they used to be. I mean, this isn't the era of walking around with a bulky, obvious chunk of metal shining in the back of your mouth.
No, not at all.
The Health Direct guidelines outline advanced materials like porcelain, zirconia, gold alloy, or a combination of porcelain fused to metal. And zirconia in particular is where the engineering gets absolutely wild.
Oh, zirconia is incredible.
It's essentially a crystal that they mill into the shape of a tooth.
Zirconia and advanced ceramics have completely revolutionized the field because of how they handle light.
How so?
Well, natural biological enamel isn't a flat, opaque white. It actually has a slight translucency.
Right, it's not just like paint.
Exactly. Light penetrates the surface and bounces back from the dentin underneath. Modern ceramic crowns are engineered to mimic that exact light refraction.
That is so cool.
They are color-matched so precisely and layered so carefully that they blend invisibly into the surrounding teeth.
And the promotional scripts, like for My Gentle Dentist, they highlight this exact aesthetic triumph. The idea that no one, sometimes not even the patient, can visually distinguish the artificial armor from the biological tooth.
Which is exactly what patients want.
Right. So that covers the crown, which is the solution when you still have a foundational root to save. But when a tooth is entirely gone, when the gap is already there, the clinical guidelines bring up the dental bridge.
The bridge is a very different procedure.
And the mechanics of this are intense. I mean, a bridge literally bridges the empty space.
Oh.
But to do it, the dentist takes the healthy teeth on either side of the gap, the anchor teeth, and places full crowns on them.
That's right.
Those two anchor crowns are then fused to a custom-made replacement tooth that sits perfectly suspended in the middle.
It is a remarkable piece of architectural engineering. You are creating a single three-tooth unit that drops perfectly into place.
And that solves the biomechanical issue.
Exactly. It instantly restores the biting surface, stops the neighboring teeth from drifting into the gap, and completely halts that bookshelf collapse we discussed earlier.
But hold on, let's look at the actual physics of this.
Right.
Wait, so to fix one single missing tooth, you have to completely shave down two perfectly healthy teeth just to serve as anchors for the middle one.
That is the trade-off.
It feels like tearing up two perfectly good lanes of healthy highway just to build a tiny overpass. Isn't that sacrificing good teeth for the sake of the gap?
This raises an important question, and it is the exact friction point that dentists have to discuss with their patients.
Because it seems extreme.
It is a serious biological trade-off. A traditional bridge fundamentally requires the irreversible alteration of adjacent healthy teeth. You must strip away pristine enamel to make room for those anchor crowns to fit over them.
Which you can never get back.
Right, you are sacrificing the virgin structure of two teeth to save the structural integrity of the entire arch and the jaw joint. This is why having these conversations, understanding the exact mechanics, and exploring alternative options is vital before any physical work begins.
Which brings us directly to the physical reality of sitting in the modern dental chair. We know the materials are incredibly advanced, but how do these custom-engineered pieces of zirconia actually get installed into the human mouth?
It is a highly specific workflow.
The Health Direct clinical guidelines outline it usually broken down into two distinct visits.
Yes, the first visit is entirely about structural preparation and data collection. The dentist has to reshape the existing tooth.
The healthy ones or the damaged one?
Either, depending on if it's a crown or bridge. They use specialized tools to remove the decay and shave down the outer layer. They have to physically make room for the crown.
Right, because otherwise it would be too big.
Exactly. Placing a cap over a full-sized tooth would make it sit too high, completely throwing off the bite and causing immediate trauma to the opposing tooth every time you closed your mouth.
Ouch.
So they apply a local anesthetic to minimize pain and then carefully smooth and round all the sharp edges of the remaining tooth structure.
Here's where it gets really interesting. They don't just take a mold and guess the shape.
No, the precision is key.
Once the tooth is prepared, they have to capture its exact dimensions. Sometimes they still use physical impression materials, the goop.
Right, the putty.
But increasingly, clinics use high-tech digital wands to scan the inside of the mouth, creating a flawless 3D topographic map of the shaved tooth and the surrounding bite.
And that digital map or physical impression is then sent to a specialized off-site dental laboratory.
To the people who actually make the tooth.
Exactly. This is where technicians use computer-aided design and milling machines to sculpt the permanent crown or bridge out of a solid block of zirconia or layer it with porcelain.
It's like medical art.
It truly is. But because this bespoke microsculpture takes time to fabricate, the dentist creates a temporary plastic crown right there in the chair.
Oh, temperate one.
Yeah, they temporarily cement this over your shaved tooth to protect the exposed dentin and allow you to chew and speak normally while the lab does its work.
So there is a massive friction point here between the marketing and the reality. I mean, think about the promotional materials from my gentle dentist at Arana Hills. They emphasize instant comfort and cutting-edge tech.
A spa-like experience.
Right. But despite the digital scans and the spa-like environment, it's like a spa trying to disguise a medical procedure. If they're using digital scans and advanced tech, why do we still have to walk around with a temporary crown for a couple of weeks in most cases?
If we connect this to the bigger picture, it comes down to the extreme precision required for dental prosthetics.
So it just takes time.
Yeah. While some clinics do invest in in-house milling machines for same-day crowns, the highly specialized materials, especially those layered to perfectly mimic the light fraction of natural teeth, or complex bridges that require intense structural testing, they still require the expertise of a dedicated laboratory.
You can't just 3D print the perfect tooth in 10 minutes.
No. You are commissioning an artisanal medical device. It has to perfectly match the color of your unique smile while simultaneously withstanding hundreds of pounds of bite force without shattering.
Which is a tall order.
That level of engineering simply takes time. The temporary crown is the necessary, if slightly inconvenient, bridge between the clinical preparation and the final installation.
And then comes visit 2. You go back, they pop off the temporary plastic, and bring out the final piece.
The permanent crown.
But they don't just glue it in blindly. The guidelines note they rigorously check the final fit, the tooth shape, and crucially, they check your bite with articulating paper.
That little colored paper you bite down on?
Yes, to make sure your upper and lower teeth meet perfectly without any premature collisions. Once it is flawless, they securely bond it in place using dental cement or adhesive. And this cement isn't just basic glue.
Not at all. Modern dental cements create both a microscopic mechanical lock and a chemical bond with the dentin of the underlying tooth.
Oh, a chemical bond.
Yeah. Once that crown is seated and the cement is cured, often with the specialized light, it essentially becomes one with the root structure.
That is incredible. And while Health Direct gives us this stark mechanical play-by-play, clinics like My Gentle Dentist are wrapping this entire invasive process in a blanket of accessibility.
Because they need patients to actually go through with it.
Right. They highlight accessible care with flexible payment plans because they know the financial shock of high-end ceramics keeps people away. They even deliberately highlight their location. They mentioned they are at Shop 15B inside Arana Hills Plaza.
Which is very strategic.
It is. It places this complex medical procedure right in the middle of your normal everyday retail environment. It really normalizes it.
They are strategically removing every possible excuse a patient might have. Too expensive. Here are flexible payment plans.
Too scary.
Here is a gentle, judgment-free approach. Too inconvenient. We are right inside the local shopping plaza. They understand that the structural damage to the jaw will continue to worsen if these barriers aren't dismantled.
But we absolutely must do a reality check here. The marketing promises a renewed, painless smile in a calming environment in just 1 or 2 visits. But the clinical realities demand that we look at what happens months or years after you leave that plaza.
The post-procedure reality.
Exactly.
Yeah.
The Health Direct guidelines are practically screaming at the patient to ask hard questions before starting. You need to know exactly how many appointments it will take. You need to ask about the specific material of your crown.
The full breakdown of costs.
Yes. What pain relief medicines are required for recovery? You even need to ask when the anesthetic will wear off enough for you to safely drive a car or return to work.
Because fundamentally, this is human engineering, and engineered systems can fail.
They aren't perfect.
No, the clinical data is very upfront about the complications. Crowns can come loose, the ceramics can break, chip, crack, or even fall off entirely if you bite down on something like hard ice or a popcorn kernel at the wrong angle.
Oh, that sounds awful.
If the lab didn't get the margins absolutely perfect, a poorly fitted crown can cause chronic pain or trouble chewing. You can get sore or swollen gums around the edge of the artificial tooth.
And there is a massive irony in all of this, the big warning from the clinical side. You are paying for this high-tech, cavity-proof, indestructible zirconia shield. But Health Direct explicitly warns that while the dental crown itself cannot decay, the natural biological tooth underneath it absolutely still can.
It is the ultimate paradox of restorative dentistry.
It feels like building an impenetrable, bulletproof house on a foundation of rotting wood if you don't take care of it. So wait, if I get a shiny new zirconia crown, I can't just ignore it. I still have to floss a fake tooth.
You absolutely do. The armor is invincible, but the biological root it protects is completely vulnerable to the exact same bacteria that caused the problem in the first place.
That makes daily hygiene just as critical after spending money on a crown as it was before.
Exactly. If microscopic plaque and bacteria accumulate along the gum line, right where the artificial crown meets the natural root, decay will quietly tunnel underneath the armor.
No, that's insidious.
The tooth underneath will rot from the inside out, the foundation will turn to mush, and the expensive crown will eventually fail entirely.
Which means you have to treat them exactly like natural teeth. Brushing twice a day, flossing meticulously around the margins of the fake tooth, and keeping up with regular 6 monthly checkups to ensure the seal hasn't been compromised.
And look, if a patient looks at the irreversible shaving of healthy enamel, the potential for complications, and the intense hygiene requirements, and decides crowns or bridges just aren't the right path, the guidelines do offer alternatives.
What else can you do?
Well, Health Direct points to removable dentures, which provide functional chewing without permanently altering adjacent teeth.
Okay, dentures.
They mention thin veneers, which only require a minimal shaving fixed to the front surface of the tooth, rather than a full 360-degree reduction.
Right.
Or, if the structural damage isn't too severe, the dentist might be able to rebuild the tooth structure using advanced filling material.
And the government actually provides significant resources to help you navigate this exact decision matrix. You don't have to figure it out alone.
There is a lot of support available.
Listeners can visit the Department of Health website or go to teeth.org.au for comprehensive information. And if you are in the middle of a dental crisis, experiencing pain, and need immediate guidance on whether your bookshelf is collapsing, you can call the Health Direct helpline at 1-800-022-222.
Which is known as Nurse on Call if you are in Victoria.
Right, and you can speak directly with a registered nurse 24 hours a day. So what does this all mean?
It's a lot to process.
It is. But when we lay the clinical mechanics of Health Direct right next to the soothing marketing of My Gentle Dentist, the core message is the same. Restoring a damaged tooth is a non-negotiable, multi-step mechanical intervention.
It's a major undertaking.
It is the only way to protect your bite, stop the domino effect of your remaining teeth shifting, and save your jaw joint from chronic stress. The technology and the patient experience have evolved to make the process far less intimidating than it used to be. But the physical reality still requires a lifelong commitment to maintenance. Your smile is an asset.
It really is a marvel of materials, science, and biomechanics. But looking at the lengths we go to, layering translucent porcelains, milling crystals, and designing spa-like environments to ease our anxieties, it leaves me pondering a bigger underlying motivation.
What do you mean?
Well, we've talked extensively today about capping and bridging the physical damage to save the structure of our mouths, the bones of our face. But consider the immense psychological weight our society places on a perfect smile.
Oh, that's true. The social pressure is huge.
If we are willing to engineer materials like zirconia and gold to perfectly mimic biological nature, just so that absolutely no one in our social circle knows we ever suffered from decay or a broken cavity, it begs a deeper question.
Which is?
Is modern dentistry truly driven by the need to fix our bones, or is it fundamentally about preserving our social identities?
Wow, that is a phenomenal insight.
Yeah.
Are we just stabilizing the bookshelf so it functions, or are we obsessively making sure the covers look flawless for our guests?
Exactly.
Thank you so much for joining us on this deep dive. Keep questioning the world around you, keep looking closely at the mechanisms behind the marketing, and we will see you next time.